Hey, Danny Matei here with PT Biz, and we're in McKinney, Texas, visiting Elizabeth Alegre and TruForm PT and Wellness. We're gonna check out her treehouse of a clinical practice inside of a CrossFit gym. It's awesome, super excited to show it off, learn about her backstory, how she's moved to a new city, new state, how she's making that work and bringing her clinical reputation with her, and how she's gonna grow over the next 5 years. All right. Hey, Elizabeth, how's it going?
Hey, hello.
Thanks for having us.
Of course.
All right, we're in McKinney, Texas. Elizabeth Alegre, right? Is that what you said?
Correct.
Alegre. This is her clinic. It's like a treehouse clinic.
It is.
It's like a second story. This is awesome. This has got a cool feel to it. And this is connected to a CrossFit gym. You got free range of the gym during downtimes, which is interesting because that's like actually a lot of the hours. And a lot of hours when you're treating patients.
Right.
So are you mainly up here for the whole time or are you downstairs?
So what I'll do for the most part is depending on the goals of the patient, right? So if it's something more acute that I have to go a little more hands-on, I always start with the manual work up here.
Yeah.
Regardless, right? And then depending, like, is their environment downstairs? Are they more in like they need rigs, they need, any kind of lifting skills,
Right.
We'll go downstairs.
Yeah.
If not, we have the second room over here that's specifically just for treatment.
Yeah.
So whether it's band use or a lot of corrections with form and stuff, we have the mirrors that they don't have downstairs. So
Right.
a little bit of everything.
So how long have you been a clinician? How many years?
I'm going on 11 in October.
All right, so you're like a clinic ninja by this point. Here's what I've noticed. People that have more experience, they just tend to do better, faster. And there's a flip side, I guess, a counter argument to that, which would be you're not from here originally either. But that actually makes it a little harder, in my opinion. So you're a great clinical skill set, new area. How has that transition been for you?
So I always feel that back home would be easier.
No doubt.
Yeah.
100%.
I post a lot. People are like, I wish you were here.
Yeah.
But I think that when I transferred here, having those 5 years in a clinic, a little faster pace, I got to meet a lot of people.
Right.
And so after that, it's been a lot of word of mouth, believe it or not.
Really?
So as much as I kind of put ads out there and stuff, it's been, hey, this is a PT I worked with.
Yeah.
She's now in McKinney. And so because I don't treat people 3 times a week anymore, if someone's a little further out and it's like that 1 time a week to come in, once every 2 weeks,
right.
They kind of set it on their schedule and make it a point to come out here. But I mean, it's been hard, but it's been worth it for sure.
Was it about that you didn't want to continue to do that? Like, why did you decide to start this?
So I decided to start because I was still interested in patient care.
Yeah.
And
were you moving further away from that?
Because I was a manager?
Yeah.
Yes. I mean, I was supposed to see as many patients, right, as any other clinician, but at the same time, I felt like the reports, the emails, all that sort of thing were taking away. And so I feel like that area burnt me out more. And then, just the all day, how many patients are we seeing a week?
Yeah.
That attention to that one patient, it's not there.
Yeah.
So I felt like I was losing my skills.
Yeah.
What was the point, of being a skilled clinician? And so I decided to jump ship, and I mean, no regrets. It's a work in progress every day, all day.
Now you've been doing it for a little while. What's been the most rewarding part of starting your own practice?
So I think it's been just being my own boss.
Like controlling your own schedule, or like deciding who you work with?
I think it's deciding who I work with. I think it's what I spend time on as far as marketing.
Yeah.
How I treat, what I can and can't do. And I just, that main call ahead of scheduling that patient that I do, that kind of free consultation call, is clutch because I get to figure out, is this someone who fits my way of practice, right? And so I'm screening these people and not wasting anyone's time or money by coming in and then, you know what, I don't specialize in that, I'm going to refer you out. But they've already come, right? So that's kind of a disservice.
Sure.
But I think that was like one of the main things. And again, sure, setting my schedule has been great for myself. But again, being hard on myself, if there's something that I know I slacked on, holding myself accountable, like there really is no one else that I can blame anything on.
Yeah.
It's just me. Yeah, there's a lot of things that I feel like I just didn't even have the time to do, right? Because I had 2 patients at the same time. So that focus, right?
Like
I didn't want to keep someone on the bike for too long while I was doing manual on the other person. And, that multitasking, that's not there any longer, right? So I really dedicate and plan out my sessions, right? Like, what are the goals that I want to achieve today? What are the things that I want to teach? And then, having that home exercise program, I make sure that these people these patients are people that go ahead and can do their own rep count, that can do their home exercise program, so that when they're here with me, right, I'm giving them 110% of what I have. But definitely skills, things that insurance used to deny.
Yeah.
That's huge. I mean, now I feel like I can get people back to what they want to do faster than when we were dealing with even 3 times a week for God knows how many weeks. That first like, hey, how you doing on the way to the bike? You know, that whole little combo, that, and sometimes it almost, maybe it was fake, you know, because you're just trying to like keep busy and make sure that everyone's entertained, you know, and you just feel like you're just trying to keep everyone alive.
Like a waiter.
Yes. And so now it feels like more authentic. Like people come in, I'm like, hey, how was that birthday party? How was this? And that's what I love about it. And I think that was kind of the theme also in the space of just making it somewhere where it felt like home, felt cozy, but at the same time, you know, like people know that we're professional and whatnot. But, you know, that interaction and relationship building, I feel like is something that I wasn't able to develop as much. You know, I got lucky if someone was one-on-one, but that was just if someone canceled.
So let's look at this space, because so you kind of do more manual on this side. And then you have a unique little setup where this is like a little mini gym area. So this is cool. And also, if you were to expand past yourself, do you feel like you could do it in this space the way that's set up?
So I feel like I could at least hire on one other PT. Just because for the privacy sake of manual stuff, then we could set up a table over here and kind of coordinate schedule-wise when we would need, or, you know, depending on the patient, would I go downstairs while the other one's working here? But I think another thing that I had in mind too is to do like small class, maybe 3 to 4 type of patient client classes on mobility or whatnot.
And you have kids, right?
I do. I have a 2-year-old.
A 2-year-old. So how has starting a business and having, you know, a young child, like how's that dynamic been? Yeah,
so I think that was the one thing that kind of pushed me, accelerated me to doing this move.
Really?
A little earlier on. I think he was about 9 months when I decided, you know, I was not having a lunch at work. I was, you know, pumping all throughout the day and then trying to finish notes, taking that laptop home with me, because when I got out at 4:30, I was hauling butt to pick him up because I felt guilty leaving, you know, such a small child so long for so many hours. And I was like, well, what if he doesn't remember me?
Your husband's in law enforcement. It's not like he has a flexible schedule. You know?
So that was the one thing that with his support, I was like, I'm going to do this now. And worst case, whatever, I go back. I can always get a job, you know? And so, he's 2.5 now, and we're still going. And the luxury of like, I don't have to drop him off at 7:05. I can drop him off closer to 8. I can pick him up a little bit earlier. If he's sick, I don't have a problem calling into myself, and my 3 or 4 patients that day can reschedule. So that's been nice.
Do you have a big goal that you want to work towards over the next few years?
So I do. I think like one of my first goals, right, is to get to the point where I am jam-packed 4 days a week. I still want to really be diligent about having that admin day. I think that that's huge, especially with the marketing. I think hiring on someone to do social media would be huge. You know, some kind of administrative assistant would be huge. So I think that once I can get to the point where I need to hire those because I am swamped, then just adding another PT would be great. And then from there, really, I mean, you know, it's hard to imagine past that, but even having a clinic where I have my own gym set up would be ideal. And I would love that. Like an open space, have my treatment tables, have the gym there. And so creating that atmosphere in just like a bigger location with a couple therapists, whether it's getting people in who are also specialists, teaming up with even different areas of healthcare. Right now, everything is so specialized. That people are like, well, I went to the doctor for this, I went to that, but that person doesn't do this. And I always feel like I am the liaison in between everyone and helping that patient out or letting them vent like what's going on and, you know, who do you need to go to get the right things in. So I think that that's huge, and somewhere where could be like a one-stop shop would be awesome. A lot of networking is meeting other, you know, clinicians in the area, which has been huge for referrals and whatnot. But again, having that relationship that the patient trusts in you to, like, you know, set them in the right direction and point them there. So I think that that's something that over the next couple of years, if I could hire a staff, even like of 4 to 5, that would be amazing.
Somebody just gave you $200,000 and they're like, build out your dream facility. What would you do?
I would take a gift card from Rogue.
$200
just
from Rogue.
Because so my fitness myself is CrossFit. So I CrossFit at a gym nearby, and so that's been my passion. I did it through all my pregnancy till my 40th week. It's been, I think, where I found like my competitive type of spirit from like team sports and being able to do that. The importance of lifting with cardio, like it's a good drive for me. And so I think that it would look like I was mentioning, just kind of treatment tables on one end, all our manual stuff, and then on the other side, maybe a little bit of turf. just like rigs, barbells, kettlebells, dumbbells, like just kind of your typical CrossFit gym equipment.
Yeah.
But there's so much functional movement, right? Like people are always intimidated by it, or people, oh, you CrossFit? That ruined my back. And it's like,
so, if you forget, you're like, what was my vision again? Boom. Yeah. You go back to this and you get to watch it. And we look forward to, looking back at this over the next few years and just seeing what you do. Because I think, like I said, this stage for most people, I think mentally is the hardest part. It's lead gen. It's you move to a new area, which I can totally relate to that. It's tough because your clinical reputation doesn't transfer from Florida to Texas with you, but you're good. And people will find that out and they'll tell their friends about it. And you'll get your marketing dialed in and you're off to the races. And then it's just, boom, we scale through people in space and you're there. So I'm excited to see it. Thanks so much for showing us your space. This has been awesome. Yeah, absolutely. Guys, hope you like this one. As always, we'll catch you on the next one.